The death toll from a coronavirus can be almost 60% higher than official estimates, according to an analysis by the Financial Times of common deaths during a pandemic in 14 countries. Statistics show an excess of usual mortality rates by 122,000 deaths. This is significantly more than 77,000 deaths from COVID-19 officially registered in these countries. If underestimation of a similar magnitude was observed all over the world, the number of COVID-19 victims worldwide would increase from 201,000, according to official figures, to 318,000. To calculate the excess mortality, we compared the total mortality from all causes for several weeks after the outbreak in March and April 2020 with the average for the same period from 2015 to 2019. The total number of 122,000 means a 50% increase in mortality relative to the historical average for the studied places. In all countries surveyed except Denmark, excess mortality is significantly higher than official coronavirus mortality rates. The accuracy of official statistics on mortality from the virus is limited by a number of factors, including the frequency and effectiveness of testing. Some countries, such as China, subsequently revised the number of deaths upward. According to the Financial Times, the overall mortality rate during the pandemic has increased compared to the same period in previous years by 60% in Belgium, 51% in Spain, 42% in the Netherlands and 34% in France. Not all of these deaths are associated with coronavirus infection and could be caused by other causes, as patients with other diseases try to avoid hospitals and do not receive proper treatment. However, the most dramatic excess mortality increased where the sharpest outbreaks of COVID-19 are observed. This suggests that most of them are not just the effects of quarantine, but are directly related to the virus. Cambridge University professor of public risk assessment, David Spiegelhalter, called the UK daily casualty count underestimated because only hospital deaths are counted. The only way to impartially compare different countries is to consider mortality from all causes. There are a number of questions to the death certificates, which indicate not coronavirus infection, but another reason. There is a feeling that they are somehow related to the epidemic. Excess mortality was most pronounced in urban areas most affected by the virus, and in some of them reporting mechanisms were completely disrupted. This is especially alarming for a number of emerging economies, where the overall excess mortality is several orders of magnitude higher than the official statistics on deaths from coronavirus. In the Ecuadorian province of Guayas, from March 1 to April 15, a total of 245 deaths from a virus infection were recorded, but the overall mortality rate exceeded the average by 10,200 people, an increase of 350%. In nearly 1,700 municipalities of the northern Italian province of Lombardy, which became the epicenter of the worst outbreak in all of Europe, more than 13,000 deaths were officially recorded. This is 155% higher than the average mortality in previous years and several times more than 4,348 officially confirmed deaths from coronavirus. In the vicinity of the Italian city of Bergamo, the worst growth is observed at the international level. The mortality rate exceeded normal by 464%. In second place is New York with an increase of 200% and the Spanish capital Madrid with an increase of 161%. In the Indonesian capital Jakarta, burial data show an increase of 1,400 deaths, 15 times higher than official statistics, according to which 90 people died from coronavirus infection. And this phenomenon is by no means limited to the developing world. In England and Wales, mortality in the second week of April was the highest in this century. It is 76% higher than average mortality over the same week over the past 5 years and 58% higher than the official number of coronavirus victims in the same period. If we want to understand how different countries reacted to the spread of the pandemic, and how it affected the health of the population, the best way is to calculate the excess mortality, said David Leon, professor of epidemiology at the London School of Hygiene and Tropical Medicine. Experts warn of serious underreporting of COVID-19 cases in nursing homes, which are especially vulnerable to the virus. Only a few countries systematically monitor patients and nursing home staff, complains Adelina Comas Herrera, researcher at the Center for Policy and Medical Assessment at the London School of Economics. But an even higher number of pandemic victims, which is suggested by statistics on excess mortality, may be a modest estimate. Due to quarantine, mortality from other causes could decrease, in particular, road traffic accidents and industrial accidents, said Marke Pekholdova, associate professor at the University of Demography at Prague University of Economics.